Good morning and Happy New Year. And thanks for attending. Today I'm joined by Dr. Carol Zimbalatti, public health physician, to give an update on our local COVID-19 situation, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, who will provide an update on the COVID-19 vaccine rollout. But before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. I encourage everyone to continue on your journey of learning as we work to contribute to the process of reconciliation. Much has changed since our last press conference on December 16th. Omicron has taken the province by storm. And in response, yesterday, we have moved into a modified step 2 of the roadmap to reopen. And schools have temporarily returned to online learning for the next couple of weeks. In addition, due to the rise in case numbers across Ontario, assessment centers only have the capacity to test those who have been outlined as eligible by the province. Eligibility can be found on our website on the testing page. As it is also very difficult to access free rapid antigen tests, and the cost of purchasing rapid antigen tests is very expensive, the province has made a change in the way we are handling isolation for those who have symptoms. The number of individuals who are testing positive for COVID-19 is an underrepresentation of the number of people who actually have the virus. So don't assume your symptoms are a cold or the flu. If you are symptomatic, have tested positive, have been told you are a close contact, please visit myhealthunit.ca/COVID guide or call our call center at 1-844-478-1400 for next steps. Unless you are eligible for a PCR test and have tested positive, you will not be contacted by public health. By following the steps outlined on the webpage, you can help slow further spread. Information on who is eligible for PCR tests at an assessment center can be found at myhealthunit.ca/COVID-19 testing. By helping to slow the spread, we can help protect the capacity of our hospitals and thus allow us to move more quickly out of this modified step 2 of the road to reopen. These aren't new measures. They've been successful in helping us navigate through all of the waves over the last 2 years. You need to hang on a little longer, adapt and adjust. You know what to do, and together we've got this. With that, I'll pass it over to Dr. Zimbalatti.
Thank you, Dr. Chirico, and good morning, everyone. Since December 16th, we had 872 new cases reported, bringing our total case count to 1,865, with 1,355 in the Nipissing district and 510 in the district of Parry Sound. The health unit currently has 458 active known cases. Since we are not aware of any individuals hospitalized locally due to COVID-19. Since our last press conference, sadly, one individual has passed away due to COVID-19. As Dr. Chirico has previously mentioned, these case numbers are a vast underrepresentation of the number of people who have COVID-19 in our district because of the limited capacity for testing. The more important numbers relate to the number of hospitalizations and ICU admissions in the province, because the goal of the current public health measures are to decrease the incidence of severe disease. According to Ontario's Science Advisory Tables dashboard, there are over 2,000 individuals in hospital in Ontario currently due to COVID-19, and this is an increase of over 64% in just 1 week. And there is no sign of slowing. Continued increases of this magnitude will quickly overwhelm hospitals, especially at a time when much of the health workforce is also testing positive for COVID-19, or are being required to isolate because of a COVID-19 exposure. Vaccination remains our best protection against severe illness. 2 doses of COVID-19 vaccine reduce the risk of hospitalization compared to no doses by 80%, and the risk of ICU admission by 93%. 3 doses further reduces the risk of transmission and severe illness. The renewed entry into a modified Step 2 of the roadmap to reopen may also slow the rate of transmission. In addition to modified Step 2 measures, the province has made substantial changes to isolation periods, and it is everyone's responsibility to follow these directions, as public health will not be following up with people who do not live or work in a highest risk setting, such as long-term care, retirement homes, hospitals, or group homes. Due to the restricted eligibility to receive a PCR test and the barriers to accessing a rapid antigen test, it is important that businesses continue to require daily COVID-19 screening, be vigilant about infection control measures in the workplace, and work with their employees if they have COVID-19 symptoms. We are at a point where the local COVID-19 situation largely rests on individuals to make responsible decisions, such as receiving all vaccination doses for which you are eligible, limiting your contacts, and isolating appropriately when you have been exposed or have symptoms of COVID-19. Now back to you, Dr. Chirico.
Thank you, Dr. Zimbalatti, and I'll pass it over to Ms. Mantha.
Thanks, Dr. Chirico, and good morning, everybody. So as of yesterday at 3 p.m., 3,074 5 to 11-year-olds have received at least 1 dose of the COVID-19 vaccine. This represents 36.3% of the 5 to 11-year-olds who reside in our district. This is lower than the provincial rate of 44.5%. As well, in the last week, 5,810 doses of COVID-19 vaccine were administered by the health unit, local pharmacies, and our local healthcare providers. Over half of these vaccines were administered at our mass vaccination clinics located in North Bay at Memorial Gardens. Thank you to the City of North Bay, the North Bay Battalion, the North Bay Regional Health Center, and our dedicated public health unit staff who made this effort possible. Individuals who are still looking to be vaccinated can book into any of our local clinics or contact a participating pharmacy. We have lots of January appointments available for adults as well as the 5 to 11-year-olds across our district. Please note that for 5 to 11-year-olds, you will only be able to book your second dose for a 5 to 11-year-old if it has been at least 8 weeks since the first dose. And eligibility is by date of birth, not birth year. So children must be at least 5 years of age at the time of booking. Thanks, and now back to you, Dr. Chirico.
Thank you. That ends our remarks, and so we'll begin answering questions. You can put them in the left of your screen, and please associate your name with them, and I'll turn it back over to Alex.
Hi, thank you. Our first question is for Dr. Chirico. It comes from Eric Tashner from CTV News. With the current staffing issues and bed shortages in the wake of Omicron at the North Bay Regional Health Center, are there any concerns from the health unit?
Yeah, from our perspective, certainly there are always concerns and the whole issues that we're dealing with now is to ensure that we can do everything that we can, not only from public health perspective, but from the public's perspective too, to ensure that our healthcare system does not get overwhelmed with the sheer number of cases. So it's really, really important, and we keep coming back to this. It's really, really important that everybody do everything possible, as we've all mentioned what Dr. Zimbalatti was talking about. Ensure that you get vaccinated. That helps really reduce the number of people that can be admitted to hospital. It's very protective against hospitalizations as well as ICU admissions. So that is critical to be able to do that. And as well to reduce the number of contacts. The best way to keep people out of hospital is to try to slow the spread as much as possible. And to do that, we have to limit the number of social contacts that we have. So people need to use really, really good judgment and everybody needs to do their part to help keep people out of hospital. For the most part, what it's going to be is that most likely the usual scenario is that most people, if they get symptoms, if they get COVID, they're mild symptoms, they can manage it very well at home with some rest and isolation for the period that they have to, and not go to hospital unnecessarily. But if you do become very, very ill with it or have breathing difficulties, then yes, that's what the hospital is there for, to look after you. But for the most part, many people will be able to deal with this at home.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Clark Heipel at Cogeco News/Your TV. Good morning. Could you please comment on the situation at the North Bay Regional Health Center? With 180 staff off due to COVID, what can the health unit do to advise/assist with the worker shortage?
With respect to the number of people that are off at the hospital, I think that's a question that's more directed to the hospital for information on that end of it. Again, it's related to the previous question as far as what the health unit can do to really advise or assist. Again, we work very closely with the hospitals. We're in contact with the hospitals probably on a daily basis for sure, throughout a lot of different programs within the health unit and our staff to help advise, deal with questions that they may have, deal with any of their employees that may be ill and in situations, what we can do to help. So that's ongoing and in constant motion, and monitoring the situation very closely because we have to preserve our workforce. We have to adjust and adapt, and just so that you are aware, these scenarios have been planned out in advance, and lots of work has gone into it. The hospital have excellent resources, plans. They work together. They have frequent communications with their staff to ensure that when there are issues, problems, capacity issues, bed shortages, they have backup plans that are in place that they move to when necessary, and we're there to help advise and work with them to do that. So I'm very confident that they have things well in hand, and yes, things could get serious, but that's what we're here for, to deal with that.
Thank you. Our next question is for Dr. Zimbalatti. It comes from PJ. Have there been any reports of adverse effects from the vaccines locally?
Thank you, PJ, for that question. Yes, we are aware of vaccine adverse events. We do process all of the notifications that come our way. Thus far, we have only received 9 reports of serious adverse events that occurred at the time or around the time of vaccination. It's difficult in some cases to attribute the serious events to the vaccine, but they did occur following, so they are reported to us and logged. And those ones that can be associated with the vaccine, appropriate recommendations are made in those cases.
Thank you. Our next question is also for you, Dr. Zimbalatti. It comes from Stu from Bay Today. Can we expect a shift in the health unit's reporting of data if case numbers are inaccurate? Will you focus more on hospitalizations, ICU admissions, individuals on ventilators?
Yeah, thanks for that question, Stu. That is something that we are looking to shift, and we really are trying to align our reporting with the reporting of the province, and we are in conversations with the province too as to what metrics are most useful, both for us and for the public to be aware of. So yes, we will be looking at our dashboard and what we are reporting so that it provides the most meaningful picture of what is happening with the pandemic locally in real time.
Yeah, and I'd just like to add that I'm really glad that you raised that, Stu. It is so important because there is a real shift in away from the numbers, because the numbers are so large, it has spread so quickly that there's no way that we can have the accurate numbers, and it's not going to change what we do. But certainly the indices that you mentioned, the hospitalizations, the ICU admission, what Dr. Zimbalatti has mentioned, is the most important thing now, because our main goal certainly is to not overwhelm the healthcare system. And so those indices are very, very important to keep close eye on, not only locally, but also provincially.
Thank you. Our next question is for Ms. Mantha. It comes from Sarah Bissonette at the North Star /Almaguin News. What is the question the health unit staff are fielding the most from the public at this point in the pandemic?
That's a great question, Sarah. So I think I'll weigh in, and then if any of my colleagues want to weigh in, they can as well. But the question that we're asked and that we're discussing most often via our call center and our other staff members, both at vaccine clinics and that are doing case and contact management, I would have to say is when to isolate, what to do if they've been exposed. How do I get tested? What if I can't get tested? So with the surge in Omicron and some of their corresponding changes to testing and case and contact management, there's been lots of questions. So this is why we've created a web page specifically for this, that's with some clear language on what to do in each of these scenarios. And we also link to the provincial self-assessment, which can walk you through a series of questions in each scenario, whether you've been exposed or you think you may have COVID symptoms, and it tells you what to do. So I would say over the last couple of weeks, that has been the biggest topic of conversation.
Thank you. Our next question is also for you, Shannon. It comes from Sarah Bissonette from the North Star Almaguin News. Regarding vaccines for 5 to 11-year-olds, will more dates in the Parry Sound and Almaguin area be added? Currently, there is one in each Parry Sound and Almaguin for January.
Yeah, so thanks for that again, Sarah. So what we do to, we consistently or daily assess availability of appointments, and then add additional appointments or additional locations in an attempt to continue to meet demand. So the clinics that are up in those two areas right now aren't full yet, but if they become full and we determine that there might be more demand, we will add additional clinic space. And we'll continue as well to offer vaccine clinics for child and youth, as well as adults, throughout February and continuing on. Yeah, so hopefully that answers your question.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah Bissonette from the North Star Almaguin News. Is the health unit facing staffing shortages due to illness?
Currently, no. And I think we're in a bit more of a different situation than perhaps hospitals or more patient-facing healthcare institutions. Oftentimes we can work from home more readily. And so we wouldn't have the same issues. But right now, no, we're doing very well. I think with respect to the clinics that are being run for the immunizations, we've had tremendous outpouring of support from communities, from volunteers, from the municipalities. It really, I can't emphasize enough that this is being made possible because of the efforts of so many, and they keep coming forward. And I know that many of them are really tired, but they keep coming and to work and are so helpful. And I think this is really the most important thing, is to get as many people vaccinated as possible so that we can keep people out of hospital and keep them out of the ICU. And it's working, and we need to continue in that. And I just want to personally thank each and every one of you that have contributed to this. We certainly could not have done it without you.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Eric Tashner from CTV News. Would the health unit back tighter restrictions from the province, if any are to come into play, even if current studies find Omicron less severe than Delta?
It's a good question. I really think that it would depend on what the restrictions would be. It would depend on a lot of factors. I think that it would also depend on what the situation is with the hospitals and whether or not, and I think that's going to be some of the considerations that are going to have the most impact on decision making. It's going to be hospital admissions, ICU admissions, whether or not the healthcare system is coping. If they're not, and things are getting very, very severe and overwhelmed, then I think that in that situation that we may have to look at further restrictions. Currently, I think we're managing well. We're trying. It's really trying to find the balance between certainly economics, health, as well as the mental and physical well-being of not just students in school, but also the general public. It's been very tough on everybody, and I think that the decisions to impose more restrictions is really being made in a very serious and thoughtful way of trying to balance all of those issues. So we have to have really good reason, good scientific evidence to move in those kind of directions. Right now, I think that the restrictions that we have, we will just have to, we've got plans in place, contingency plans, search plans for hospitals, and we just have to see how this unfolds. But I think each individual can do their own part. Whether or not the restrictions are put in through legislations, each individual can make decisions on reducing the amount of social contacts, reducing the chances of spreading this virus. So we all play a role in this.
Thank you. Our next question is for yourself, Dr. Chirico. It comes from Stu from Bay Today. Do you support the designation of elite when it comes to the OHL hockey, whose teams are playing in front of empty arenas but continue to travel to other cities?
Yeah, that's a good question. Again, it's a matter of how you balance things. I think that by not having a lot of fans in the stands certainly does help. I think it really will depend on what measures are being put in place and adhered to by the staff, by the players when they do travel. So yeah, it is controversial, but I think that with those smaller groups, that if they adhere to really rigid protocols and put them, they are in place, and testing, I think it can certainly help reduce the spread. There is the potential, but if we're finding that it's not, then we really need to revisit it. And that goes for professional hockey as well. If you're finding that there's significant spread among them, then that needs to be revisited.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Stu from Bay Today. What can outdoor enthusiasts do to keep amenities open from a public health standpoint?
Well, thank you for that, Stu. An excellent question. I think that when people, being outdoors really reduces the risk for sure. It doesn't eliminate it, but it certainly really reduces it, because obviously you're not in an enclosed space where we know that the Omicron can certainly significantly spread. So I think what they can do is just use really good judgment. And in order to do that, you don't want to be close contact with other people. There's plenty of outdoor sports that you can partake in to get great exercise, and really it's a low risk activity when you're outdoors and you're physically distancing. So those are the main things that I would say you need to consider in order to continue to do it safely. if anybody else wishes to add any comments to that.
No, I agree with your comments, Dr. Chirico. Maybe just add to additional precautions of if you are feeling ill, maybe avoid
Sure.
partaking in outdoor activities at the time, especially if you are going to be within, you know, a few meters of other people. But definitely outside sports, we want people to be able to continue exercising, and exercising outdoors is the safest way to do that. And so we just encourage people to take the precautions when they do so.
Thank you. Our next question is for Dr. Chirico, comes from Clark Heibel at Cogeco News/Your TV. With gyms, restaurants, and other settings closed, even for the fully vaccinated, will there be a place for vaccine passports moving forward?
It's a great question, Clark. I think that probably in the future, when things change a little bit, I mean, it's going to be a slow transition. I don't think it'll be an on-off where you've got all these restrictions and then no restrictions. So I think that there's still maybe some put in place in the future when we do start to reopen. And again, you know, we certainly, as you've heard, encourage everyone to get vaccinated. And I do think that there probably will be vaccine passports in use in the future. Eventually, you know, our hope is to completely eliminate them, but I don't think that's going to happen initially. Dr. Zimbalatti, do you have anything you'd like to add?
Yeah, I mean, that's a really important question. And I think it is important to recognize with Omicron that the double vaccination really doesn't afford a lot of protection against transmission. So you cannot rely on the vaccine passport to judge that a facility you're attending or gathering you're attending is safe, based on the fact that everyone there is double vaccinated in terms of transmission risk. The benefit remains for reducing severe illness amongst those who participate in the vaccine passport, vaccine certificate program.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Rich Coffin at Moose FM. Can you detail the goals with the new COVID-19 guide page on our website?
Sorry, maybe you could repeat or clarify the question. From the question, I understood that you wanted me to review the current guidance on restrictions, which is extremely lengthy, and I don't think I would be able to do that in this format. And I would recommend you visit our website or the Ontario government's website to review.
I think what they're looking for is the steps that were put on the website around what to do if you're symptomatic, a close contact, or tested positive.
Yeah, so I can speak to that, Alex, if that's okay. So as Dr. Chirico mentioned in his opening remarks, you know, over the past 2 weeks, the COVID-19 situation has dramatically changed, both locally and provincially. Locally, you know, we had 709 cases reported over that period of time, which is 6 times higher than the number of cases in the previous 2 weeks. So because the province as a whole and as well our district is experiencing a major surge in the highly transmissible Omicron variant, in response, a number of things have changed. The way we manage cases, the way we follow up with contacts, access to testing and who's eligible to testing has changed dramatically over a 2-week period that actually coincided with Christmas and New Year's, and a period of time where people might not be as tuned into changing guidance and the news and all of those things. So based on questions we were receiving through our call center from the media, as well as to our staff members who were out in the community working, we decided to put up the COVID guide on the website. And this is just to clarify if you've been exposed, if you have symptoms, who's eligible for testing, who's not eligible at present for testing, and what to do about it. So next steps. So we tried to put something up there that's very clear So people have some type of written guidance. And we, as I said, we link to the provincial self-assessment as well. So you can actually go through that assessment based on your specific circumstance and figure out what your next steps are. And if you don't have internet access, you can always call the health unit's call center and ask us for some advice on what to do.
Yeah, I'd also like to add, thank you, that's a very good explanation. And also like to add that as the pandemic evolves, these recommendations can change and change quickly. So we encourage people to stay up to date, and that's why we're putting it on the website. And we recognize too that it can be confusing, so don't feel bad if you are confused. You know, we'll try to help you through it. Sometimes we feel confused with some of the things, and we have to work through it, get feedback, and then try to get it up to date on our website to clarify it for the public. So stay tuned. Things change and change quickly, as I'm sure you're all used to.
Thank you. Our next question is for Dr. Chirico. It comes from Sarah Bissonette from the North Star Algonquin News. What is the health unit's best guess at students going back to school on the 17th?
Yeah, good question. And I might have to leave it at just being a question because I don't know. This will be a provincial decision and not a local decision. So there's too many unknowns from my perspective right now to be able to determine that. And a lot of it will depend on how the pandemic evolves. It also depends certainly on, I think, the pressures on the healthcare system.
Thank you. Our next question is from PJ. It's for Dr. Chirico. It's been almost 2 years since the pandemic started. Were you expecting it to last this long?
No, it really wasn't. I didn't think that. I thought that by the end of 2 years, we would have been on certainly recovery. I thought we would be in the recovery mode, and I certainly was wrong. But you know, we're learning a lot from it. I think that it's going to bode well for. This is not going to be the last pandemic that we're going to have to face. We're basically a sneeze and a plane ride away from the next pandemic, and we've learned a lot. We've got a lot of things in place now, and we've made mistakes, but we certainly are learning from them and can be better prepared in the future. So it's so unpredictable, but no, I didn't think that we'd be in probably the largest wave that we're going to have at this time.
Thank you. And our next question is for you, Dr. Chirico, comes from Eric Tashner from CTV News. What has been the most difficult thing for the health unit since the pandemic began?
It's a good question. I think the most difficult part of the pandemic for me and the health unit is when we didn't have any other way to fight the pandemic and the virus, and saw so many vulnerable people die from the pandemic, and we're not able to offer protection other than the public health measures, but we didn't have vaccines. And when you look at back when so many tragic deaths occurred in long-term care homes that really didn't have the vaccines, and then look at some of the outbreaks that occurred once we did have vaccines and how effective they were at preventing severe illness. I think that was the most difficult thing. The pharmaceutical companies did an amazing job to get the vaccines as quick as they were able to do, and for the governments to fast track the process and to streamline it and still ensure quality and safety of the vaccines. So I think for me, that was the most difficult, where we did the best that we could and everybody did the best that they could, but we still weren't able to protect everybody. Dr. Zimbalatti or Carol, Did you have anything?
Yeah, maybe I could just, I agree with you in terms of, you know, what has been the biggest challenge throughout the pandemic. If I may extend that question to kind of what is the current biggest challenge? And I think that is really communicating the pivot that's necessary in terms of how we think about this Omicron wave versus how we thought about previous waves. And because the tools that we use are somewhat similar, but we're applying them in very different ways because Omicron is so different. We are not in a phase of the pandemic where containment or absolute control over the virus is possible. It's really about what can we do to shrink the spread, like to reduce the spread a little bit, to keep hospitalizations manageable. And so that's why there's been the pivot in testing and the pivot in case and contact management. And I think it's a really difficult thing to process because, you know, you've been, as a public and healthcare professionals throughout the pandemic thus far, we've been, you know, reinforcing if you're ill, go get tested, and then you know, and then you'll know what to do and you'll receive your instructions. But at this point, we aren't able to do that. And it's really about recognizing symptoms in yourself and taking the responsibility, individuals taking the responsibility themselves to find out what they should do in their specific situation, whether it's they have symptoms, they've been exposed, that sort of thing. And it's difficult. We recognize that. And I think that's the biggest challenge we're facing right now is trying to convey in the simplest way possible what the courses of actions that the public can take to have the most impact on reducing the spread of Omicron.
Thank you. Very well said. So that completes all of our submitted questions for the press conference. So that will complete our press conference. We'll be back for bi-weekly press conferences. So our next one will be on January 20th. Thank you.
Thank you.